Hi, welcome to Talking Brains, a podcast about mental health, books, and what makes brains happy. I'm your host, Dr. Stephanie Sarkis. Today's guest is Dr. Mark Bertin. Dr. Bertin is a developmental pediatrician in Pleasantville, New York, and the author of How Children Thrive, Mindful Parenting for ADHD, and Mindfulness and Self-Compassion for Teen ADHD, which integrate mindfulness into evidence-based pediatric care. He is an assistant professor of pediatrics at New York Medical College, on the faculty of the Windward Teacher Training Institute, and on the editorial advisory board of Common Sense Media. His blog is available through mindful.org and Psychology Today. For more information, visit his website, developmentaldoctor.com. Hi, Mark. Welcome back to the podcast.
It's great to be here. Good to see you today, or at least hear you today.
Always a pleasure. So we're going to talk a little bit about mindfulness and self-compassion. So if you could first explain a little bit about what is mindfulness.
Mindfulness is, it gets used so many different ways. And I think, on its simplest level, mindfulness can be seen as just unbiased awareness, which is way more complicated than it seems. So I'll expand on it a little bit. I think all of us are aware, with or without ADHD, that we tend to get caught up in distraction and reactivity. We're here, but our minds are caught up in anxiety-provoking thoughts of the future or anxieties of the past, or, we could enjoy what's going on right now, but we're still ruminating about what happened 3 hours ago. And all of that's kind of inevitable. There's no goal to any of mindfulness practice that it goes away completely. But the basic starting premise of mindfulness is that we're going to live our lives more easily and relate to what's going on more easily also, if we just see with clarity, just come back to our best intentions more consistently, which is why mindfulness practice is something anybody can really do if they choose to. It's not about being still or having a quiet mind. It's about a little bit really about changing how we're living some. So we're just able to manage our lives with more skill. And that could mean just being aware enough to know when. One of the examples I use around ADHD a lot is that you might be in a situation where there's just too much noise and distraction around to have a useful conversation, and some friend of yours is really trying to get into an intense conversation, like in the school cafeteria, and seeing things clearly, being mindful isn't that suddenly you can be totally laser focused. That's an illusion. And if you think that's what you're going to get out of it, you're going to quit pretty quickly. Seeing clearly might just be having the confidence, the self-compassion even, to recognize that even though it's difficult, you need to, you tell your friend, like, I just can't have this conversation here. It's too distracting for me. Let's go outside. And that's skillfully navigating a situation. So the first way to look at mindfulness, I'll add one more thing and then I'll pause for a second. But the first side of practicing mindfulness is just recognizing that there's value to trying to get out of autopilot and live our lives with more awareness. And then the second one, which is huge for all of us and also very specific to ADHD, is that without a little bit of effort, stress and reactivity tends to just perpetuate itself, so that something makes us feel anxious or worried, and that changes a little bit how we think, and then how we're thinking changes how we feel, and how we feel changes maybe how our body feels, and then when our bodies feel off, that also changes how we think. And our whole life can just be this constant escalation and staying caught up in this physiological fight or flight response. And while some amount of stress is useful and keeps us motivated, being chronically consumed by stress isn't a useful way to be living. It changes how we communicate. It changes how we problem solve. It changes how we feel. That's particularly true of ADHD, because the way we see ADHD now as a disorder that affects executive function, executive function skills are kind of our life management skills. So it may be that just, navigating day-to-day life is more stressful than it needs to be. So when you put all that together, in general in life, there's value to just doing the things we can to help step out of chronic stress, to step out of that stress cycle more consistently. And again, we don't want to eliminate stress. It keeps us safe, but to manage it better. And specifically to ADHD, managing ADHD is really complicated, and it's hard to stick to plans, and it's hard to know what to do, and we have to make difficult decisions, and all of that's true. So clearly, when it comes to managing ADHD, if we can manage stress, or another way of looking at mindfulness, it is a process of building our own resilience. So if we can stay more resilient and grounded over time, that'll help us with something like managing ADHD.
And I've read about living with intention. Does that correlate with this?
I actually love that question, that summarizing of it. It does have a lot to do with living with intention, because if you think about it, when we're caught up with stress or reactivity or fear, or we just lose touch with often what we know best. In any situation, we may not be doing or saying what we would recommend anybody else do or say in that situation. So that mindfulness in many ways can be seen as a way of coming back to our best intentions in any given moment, and then also being patient with us when we inevitably lose touch with our intentions. And in fact, it's a great way to reframe meditation practice as a whole, which can be really frustrating otherwise. The intention of meditation, at least mindfulness meditation, isn't to be calm or to relax specifically. Thankfully, that happens sometimes. It's broader than that. It's that we're practicing things that become traits, that become more part of our day-to-day life. And one way of looking at it is exactly like you mentioned just now, in that we're setting this intention. It's a really unusual thing in many ways to be practicing. I mean, it may be the only activity we're doing in life where we're setting out to do something we inherently can never do right. So we're trying maybe to focus on the feeling of breathing, only because it's there. It's just like, it is something we can focus on. We're not trying to do anything specific or make anything happen. And then inevitably we lose touch with that intention. Right now that's what we've decided to do. And then our mind gets distracted. And maybe the most important process of the whole moment, that whole situation, is both noticing when we've lost touch with that and coming back, and also doing that with a sense of self-care of like, wow, we're trying to do this and we just, lost track again. And there's no need for any frustration or self-judgment or self-criticism, because it's just to be expected. But you can expand that view to, well, first of all, just mindfulness practice as a whole. So you decide this would be a good idea to try, and then you do it for 3 days and then you forget. And a week later you go, oh, I got to start again. And it's the same thing. You don't have to be really harsh with yourself in that moment. You can just say like, oh, wow, it's hard to form a new habit. And then you catch yourself and you try to start that new habit again. And it gets easier over time. But then you can expand that out again, which is the real intention of mindfulness, is to live differently. And we can bring that sense of doing our best to keep in touch with our own intentions to kind of anything we're doing. So we're having a difficult conversation and our intention is to stay calm and to communicate well. And then we get rattled and it all comes apart. And, the most important moment is, can we develop this mindfulness practice that lets us notice that happened, and maybe with a little more ease and openness, just come back and realign ourselves with like, okay, I lost, got rattled again, got angry again, got flustered. But now I'm going to come back. What do I think would be the best way to handle this situation? And that is I think a really useful way of reframing mindfulness practice. In many situations, we do have a pretty good sense of what would be best. What would be best is almost a value word, but what would be, the most skillful things we can do. And then we lose touch with it. And then we try to come back. And it's meant to be a very proactive process too. It's not that we're going to be okay with everything, but we may just, by coming back, by stepping out of stress, by staying settled, however you want to frame it for yourself, we can come back and try again, or maybe adjust or choose to do something different.
So it sounds like progress is progress, regardless of how often you do this, that just the fact you're doing it is what matters.
100%. 100. I mean, one of the other analogies used with mindfulness a lot, which isn't the easiest because it does require ongoing work, is that it's a little bit like physical exercise where if you, and this I know can be a trigger for some people who, there's lots of us struggle to stay in shape physically, but really our bodies respond to regular physical exercise by getting in better shape. And then if we stop regular exercise, they start getting out of shape again. And that's a lot of like really what mindfulness practice is like. I mean, our mind does its own thing an awful lot of the time. And certainly we're all familiar with the fact that, without a little effort, it's easy to get caught up in stress and reactivity until we do something that lets us settle down again, a vacation or something. And then we realize like, oh, I feel a lot better now. It would be nice to be able to, live this way more consistently. So mindfulness is kind of like this ongoing practice that lets us, sustain these traits, these ways of living that are kind of hard to do otherwise. And again, it's not, I just want to always come back to, it doesn't mean that we have to be a certain type of person. It doesn't mean our minds are going to be always quiet. It doesn't mean, our bodies are going to be always still, or we're going to stay calm every time somebody, gets in our face. It just means that we're doing our best to, live with whatever's actually going on with as much skill as we possibly can.
And with ADHD, I know there's a tendency to be really tough on oneself, especially with the amount of progress, and people compare to, well, my friends without ADHD and they're able to do this better. Can you speak a little bit to how that self-compassion piece ties into that self-critical component of ADHD?
Yeah, absolutely. This new project we did, the new book I did with Karen Bluth, really we wanted to focus on this idea, which is being researched more and more in Western psychology, of something called self-compassion. And certainly when I hear myself say that term, I always feel like there's a piece of talking about mindfulness. I always want people to sort of question everything and sort of look for the meaning beyond the words. Like just ask yourself, is it true? So if that phrase sounds new agey or anything, think about what it really means. What it means is that if we begin to pay attention to our inner worlds, most of us tend to have a really aggressive and assertive voice of self-criticism. And it's really different than we would advise anybody else or treat anybody else. So something happens, and like the first reflexive thought we have is like, you idiot, or you blew it again, or you always, or I should, or it's just very harsh. It's kind of like, I don't know if anybody remembers the Muppet Show, but the two old guys up in the balcony, Waldorf and Statler, who just sit there, and no matter what's going on stage, it doesn't matter what's going on stage, they have something negative to say. And that
also hilarious, though.
Yeah, well, yeah, it's true.
That's a tricky part.
Yeah. So all of that's true also, but it's funny you say that, because the other example I use a lot is Lucy from Peanuts. So it's like a comic, but there's some reality to that, like constant heckling and criticism. And yet in the same moment, I sometimes use an example, like if you can picture yourself like, being asked to come up in front of an audience of people, and like as you're reaching the stage, you trip over like a bump in the carpet and fall, and your papers go everywhere and everyone's watching. In this moment, even listening right now, you can probably imagine what you might think, to yourself, of yourself. Everyone's like, I'm an idiot. I'm so embarrassed. Everyone's looking at me. I always do this. These things never go right. And then if you take a moment and think about like, well, if you're in the first row of the audience and your best friend did that, what would you do? Well, you'd probably, immediately leap to their side and say, don't worry about it. Just take a moment to settle down. It's okay. No one's judging you for it. And it turns out, so Kristen Neff is probably the psychologist best known for developing this concept of self-compassion and from a research perspective. And it turns out that in spite of the fact that we identify with that inner self-criticism and perfectionism as what gets us to succeed, life is more nuanced than that. What we teach about, for example, mindset in early childhood is that one of the things that helps kids develop persistence and resilience is when we focus them on the fact that it's effort that makes a difference in life, that none of us are going to succeed all the time. So that when we're caught up in self-criticism and perfectionism, it actually might on some level keep us, moving hard to get better for a while, but it tends to lead to burnout and less sense of well-being. And very importantly, it actually undermines our long-term resilience and problem solving, because as soon as we do make a mistake, we quit, we get consumed by this, I'm never going to succeed. This doesn't fit my picture of perfect. So, so long-term resilience and effort and problem solving rely on shifting towards kind of thinking about our inner lives the same way we would treat someone we really care about or treat our best friend. And it's hard. It's a really entrenched habit. It's not like it changes in a day. But the practice of self-compassion is working with, and I can lay out what an actual self-compassion practice in a couple of minutes, but just conceptually first, what it means is we can practice working with this mental habit and changing it. So often that voice of the inner critic seems like something we need to, talk back to and logically, and if I could just get better at this and accomplish more, it'll, all these sort of rational ways we're trying to work with what is really just an entrenched irrational habit. It's like a mismatch in strategy. We're not going to get rid of it through logically making it go away. We just have to work on it like a habit and try to change it while recognizing that it is just an irrational habit. So with ADHD, Dr. Barkley has that brilliant summary of ADHD that it's not a disorder of not knowing what to do. It's a disorder of not doing what you know. That's a hard way to live. And, there, like you just said a few minutes ago, there's this, there may be a sense of just constant frustration that things are harder or that you knew better and some things didn't go right, or, you could be getting better grades and you could, but you're not. And that has an impact. And then when we lose, when our self-image becomes to be affected and we lose self-confidence and we lose self-esteem, that then begins to affect, again, it's just this another vicious cycle of that affects how we feel and our ability to persist when things get difficult and our resilience. So this, concept of practicing self-compassion would help, will help anybody with, resilience and how they feel. Actually, I'll just add one side note, which is none of this is really supposed to be self-help, because when it comes back to sticking to our best intentions, there's really a much broader premise of when we practice mindfulness, when we practice self-compassion, because we start to feel more settled and we start to see with, more clarity what's best in any situation. It affects everyone around us for the better too. So self-compassion practice typically impacts how we treat other people as well. I'm sure all of us are familiar with that sense of like when we get defensive and self-critical, that often changes very directly how we treat everyone around us. So when we can practice these things, that helps us sustain the resilience, that helps us manage difficult situations like living with ADHD. But if we get caught up in the vicious cycle of just feeling rotten about ourselves and critical of ourselves, that directly gets in the way of honestly, navigating situations, making, what are often challenging decisions about how to address, a problem. All of it gets undermined by self-criticism. And when we're caught up in that, instead of coming at life with a more balanced attitude of, self-compassion, which can sound like a wonky, like a weird word, but it really just means that we can learn to treat ourselves, no better, but no worse than we would treat anyone else we care about.
And how does taking stimulant medication for ADHD play into all this? Does it make self-compassion possibly easier, or does it make one more likely to focus on getting things done and maybe not practice as much self-compassion? Is there any evidence of
that? Yeah, that's a great question. And I do want to actually come back around to actually describing what self-compassion practice looks like. But but something like the medications and ADHD are a great example of both, looking at both mindfulness and self-compassion. It's such a loaded topic for totally unfair reasons to me. I mean, they've just become this bugaboo in society that it isn't fair. So when you look at ADHD medications, there's that concept of just trying to see any situation with clarity, which might mean starting with just the fact that, we know an awful lot about, in spite of all the fear, in spite of all the misinformation, in spite of what might have been like an initial bad experience that any individual might have had, the research is pretty blunt that they've been around almost a century, that they're, safe and effective, that they shouldn't change your personality. You should feel totally normal, except, that your ADHD is better under control when you take them. So you can look at mindfulness and decision making in essence, and just trying to see with clarity what's going into your decision, because there's so much fear and confusion around just making the choice. And then when it comes to your ADHD in general, there's never one thing that changes all of ADHD. And even when I talk about mindfulness, it's really just meant to be as a support for all the rest of what we know works well for ADHD. So certainly anything that makes your ADHD more manageable should help with your overall sense of resilience and well-being and self-confidence. And the medications can be a huge part of that, because they help you feel, more on top of things and successful day to day.
And you mentioned you're going to tie that back around to self-compassion.
Yeah, I mean, I think if we're going to talk about something like self-compassion practice, obviously we should describe what that looks like. And so it's often described as a practice in 3 parts. And practice is an important word because you really do want to set aside any short-term expectations and just realize you're working towards long-term gain. You're not expecting, in the middle of a crisis to suddenly do this and feel better. So it's usually described as a practice in 3 parts. And there's all sorts. I think there's a lot, like an actual guided practice you can get to, like through my website and a couple of different places, or you can look up Kristen Neff's work or Karen Bluth's work and find the actual practice yourself if you want to try it. If you want to actually do the practice. But to describe what it looks like, the first part of the practice is mindfulness itself, meaning that part of taking care of ourselves is just really seeing what's going on. And that means, I can, as I'm saying that, I can feel myself start to want to go down this road of describing mindfulness in much more depth, because there's so much to it. I mean, just recognizing that, there might be positive things going on in the middle of a crisis that we're not giving our full awareness to. And that's important to acknowledge, because part of our long-term resilience does rely on noticing the good stuff too. There might be, really challenging things going on at any moment. And part of self-care is just, even before we can do anything about them, maybe there's nothing we can do about them, we need to just acknowledge it, like we would for, again, we'd want to comfort a child or a friend who is struggling. So part of the practice is just developing a sense of just awareness, like this is what's going on for me right now. Just accept, like, this is it. This is my life in this moment. And that can be a big step in and of itself, because maybe we are feeling unhappy or overwhelmed in a particular moment in time. And while we're doing our, while we're actually doing our mindfulness practice, maybe even all the time, it's a different discussion, really probably through all our lives, there's value to seeing this is what's going on. So that's part of the practice, is just, this is what's going on for me right now. And then the second part of the practice is something without really paying attention to. A lot of us don't notice when we're in the middle of a crisis, which is when we're in the middle of a crisis, we often feel isolated. We feel like we're the only ones this ever happens to. I am the only one who is so bad that I do these things. There's just this inherent sense of separation. So the second part of the practice is often referred to as something called common humanity. But to put that into words, it just means like, this happens to everybody, or whatever words you want to use. All people have moments like this. You can make it small, you can make it big, like all people with ADHD or all humans everywhere, whatever feels natural. So the second part of this particular mindfulness practice is we just bring into the practice itself just this awareness of, like, I'm not alone. Like, this happens to everybody. So when I'm teaching it or when I'm practicing it, it's often you're sort of, as best as you're able, trying to time it to your breathing. You're just sort of like, so you're breathing in with a sense of just awareness, like this is everything that's going on. And then you're sort of setting an intention for yourself, like a signpost with each out breath. So in the out breath, it's like, this happens to everybody. And then the really vital part of the practice is that sort of non-striving setting of an intention of treating ourselves better. So we try to put into words how we would treat, a child or a pet or a close friend. So it's So it's just this sense of self-compassion and it's usually put into words with something like, may I be kind to myself in this moment, or may I approach this moment with kindness and strength, or just the words kindness and strength. It's just, again, just setting that reminder that it's possible. So in this moment, can I treat myself with kindness? And you can easily get caught up in that. You're not trying to make yourself feel that way. You're just trying to remind yourself, maybe even think of a friend, because you know what that feeling is like, because you probably have had it towards other people. So that's a over, like an over description almost. So the shorter way of just saying it is, that there's three parts of the practice. We're trying to sustain awareness. So this is what's going on for me, the good, the bad, and the ugly. This is everything going on right now. All people have moments like this, and may I approach this next moment with kindness or with strength or whatever comes to mind. And then, like you said earlier today, we lose track of that intention for sure. And, that's fine. We might daydream, be caught in distraction for a few minutes. And when we notice that, we just come back again and just do our best to start over.
And I like too in the book where you mentioned that we usually have an event happen to us. We have a feeling about the event and that causes our reaction. Could you explain a little bit about the mindfulness kind of reframing of that?
Sure. So, related to everything we're talking about today, we can start to look at in any moment. There's all sorts of, stuff going on, obviously, and some of them are external things we got to, live with differently. But then some of them are very internal things that are affecting how we feel and how we live. And one of the ones that's often quite a challenge for many of us, but certainly has been studied as a specific challenge with ADHD, is emotional reactivity. So emotions are just part of life. They're going to come and go whether we want them to or not. And very often we're living our lives in a way that it feels like emotions and how we deal with them, emotions and how we react to them or relate to them, are all one and the same thing. So, an emotion happens and immediately we're, crying, angry, running away, eating, whatever it is, we just got this stuff. And it all feels, enmeshed, like it's inseparable. But another aspect of mindfulness practice, it's one of those things which can sound cliched, but it's meant not to be. It's meant to be practical, is when we begin to practice, we start to create just a little space of just noticing what's going on without immediately reacting to it. And in fact, that's another way to reframe the meditation practice, is it's not trying to be calm. It's that for 5 or 10 minutes or whatever we pick, we're setting the intention of, like, whatever happens right now, I'm going to sit here. I'm not going to react to it. And that becomes a skill we develop over time. So I'm really, really upset. And normally I would do X, but right now I'm just going to sit here for 10 minutes and I'm restless and I'm not happy. But it's okay. For 10 minutes, I'm safe. And I'm just going to try working with that, try to develop some patience with it almost. So when it comes to our emotions, we can practice and build, just like any other skill in life, the ability to notice the emotion, which in and of itself may be a more complicated thing than it seems. It might have different parts to it, several different emotions that are seeming like one, or there might be a physical component to it of like feeling sick to our stomach. And we can develop the ability to notice those emotions and then catch ourselves long enough to realize, like, what we do next isn't necessarily, as fixed as it seems. And we build up an ability. Choice is, it's sometimes said, our ability to choose an outcome, and inherently comes from the ability to have something happen and to have enough space there to intentionally make a decision of what comes next. So with practice, that ability to create that space becomes more part of day-to-day life. And again, if this starts to feel too abstract, there was a study done, I actually was going to say last year, maybe 2 years ago now, in which they looked at mindfulness practice for children as young as 7 years old and showed improvements in their ability to manage their emotions. So it is feasible. It doesn't, again, I wouldn't ever want anyone to present it as like a miracle cure of any kind, but is certainly a very useful thing to work with, and is really can be a valuable part of life for many, many different people.
What would you say to someone that is working at developing mindfulness and they feel like they just aren't making the progress they want to make? Because I know the idea is that not to put end goals to it, but for a lot of people, they are very end goal oriented. So what would you say to someone with ADHD that feels that they just aren't making the kind of progress they want to make in mindfulness, and it's just not coming naturally to
Right.
them?
I mean, I think there's several different things to think about. I mean, the first one I would say is if you're really worried you're not making the right progress, there is an aspect of it that sometimes has to do with examining what your assumptions you're making about mindfulness practice are in the first place, and trying to let go of pictures of perfectionism or pictures that something specific is supposed to happen in a short-term way, certainly, but probably in a long-term way to some degree also. So one of the things that undermines mindfulness practice, chronically, quite often, is when you come into it with this premise that I'm going to feel relaxed, or this premise that I need to be calm all the time. So one thing that is getting in the way in situations like that is the expectation that things are going to be, any particular way. Certainly in the short run, but sometimes in the long run too. So that's a big one. Is you may sit in meditation and your mind may be busy the whole time, and it's still meditation, and that's fine. So letting go of sort of those sorts of things helps a lot. The second thing is, it really is meant to be a long-term practice. So, I've heard some of the more famous teachers of mindfulness say things like, put a mark on the calendar for like a year from now, and don't even think about whether you're progressing until then. Because it would be silly to do it if nothing was going to change in life. There certainly is an intention that things are going to change in life, but it isn't necessarily going to be so apparent moment to moment in the short term. And then a third thing I would say specific to ADHD is that having ADHD often makes it hard to create new routines and stick to new habits and stick to a plan. And, that is a good moment of non-judgmental awareness, of just recognizing that part of the reason your practice might not be progressing is that you haven't come up with the routine yet to practice regularly, and that's to be expected. And the most important thing to do is to just, if it's important to you, if you think it might be valuable to not get caught up in judging yourself for what happened before, and to try to learn from it, and just recognize that, okay, maybe my plan was too open-ended, or, maybe doing it on my own isn't going to work. I need a class, or I need to partner with a friend, or, just come back to the practicalities of, it's hard to, again, this is true for everybody. It just may be harder with ADHD. It's always hard to form a new habit. This comes up a lot when people ask me about mindfulness and ADHD, and is it feasible? It's been studied. It's feasible. People can do it. It's about expectations, and for mindfulness and ADHD in particular, it may just be recognizing that there also needs to be an emphasis on just the practicality of how are you going to remember to do it. And that's just, and that piece of just recognizing, like, that's part of it. I got to make sure I plan and do it regularly. And that's hard for me. That's totally normal. And it doesn't mean anything inherently good or bad. It's just a piece of the, piece of the puzzle to solve.
And how does mindfulness overall impact how people relate to those around them? I think you mentioned that there's more of an idea of loving kindness or flexibility with others. Could you speak more to, if people do this practice, even if they don't feel like they're doing it right, quote unquote, how it might influence day-to-day interactions?
I think really that's actually the bigger, that's really the depth of practice, is to recognize that it's about, supporting the world around you. I could say on a general level first, I think it's probably intuitive on some level. You can think about how you talk to people, how how you feel, and how that influences how you talk to people, and how you problem solve, and how you are just living like after a 2-week vacation. There's just, when we're at our best, that obviously and inherently changes how we treat everyone around us. So the bigger premise of mindfulness practice is that by uh, doing the things that sustain our own resilience and to help us, maybe be the ones who are navigating any particular situation, with some open-sided clarity, changes everything for everyone around us. And when it comes to communication, for example, I mean, one really hard thing to pay attention to and live with in life is, in any situation, obviously we only control our own piece of it directly. So if you have to, communicate with someone who is seemingly totally irrational and off base, it's not your fault they're irrational and off base, but you also can just recognize that there are things you can do that are going to escalate the situation. There are things you can do and say that are going to de-escalate the situation. Also, being fully aware of the whole situation is recognizing that there might be some goal you need to accomplish. So being mindful in communication, for example, doesn't mean being passive. Maybe a lot of us have a habit maybe of ducking confrontation. It's way more nuanced and challenging than just being quiet. But the point is that concept of if we can sustain our own sense of balance, our own whatever words you want to put to it, don't get too caught up in the words. It's more about the concept. If we can be at our best in that situation, then we'll handle it as best as we're able. And that's really the only thing we can control. And it's an important model to bring some time to being a parent in the workplace. I mean, there's a lot to say, do that's proactive, and we got to take care of stuff. And I heard somebody say recently that, the practice of mindfulness is inherently one that's linked to activism, because as soon as you stop long enough to see what's actually going on in the world, you're going to want to improve things and work towards change. So it's a very proactive practice. And yet in any single moment, we can recognize that, whatever is going on in front of us, the only thing we're in direct control of is how we are relating to it. And if we can do that with skill more of the time, that's going to impact everybody else. And, when you talk about mindfulness in families, for example, you can't make a child meditate. You can't make a child do mindfulness. It can certainly be a useful thing for children to do if you can guide them there over time. And yet you can be very confident that if you are practicing mindfulness as a parent and bringing that into your home, your children are benefiting from it and are probably learning mindfulness.
And what would you say for people that are in the moment, they're talking with their child or at work and they're dealing with a difficult person or difficult situation? What's a hands-on mindfulness technique that they can do right away to help them reevaluate the situation?
I mean, that's a great question, but kind of one with a little depth. I mean, because there's two parts to my answer. I mean, certainly the bigger premise of all of mindfulness is by practicing it consistently, it just becomes intuitively part of life. So it isn't necessarily that you're going to actively make a decision to do a mindfulness practice in a challenging moment. It's it's actually the opposite. If you've never practiced before, that's never going to work. It's more that because you've been practicing regularly, you just, you've developed this intuitive way of noticing when you started to feel off balance or been distracted in conversation for several minutes, and then to come back more quickly and more consistently. So some of it is just trusting in the practice itself. However, there are in the moment practices that can be very effective. And one of them relates kind of to how I framed that self-compassion practice a few minutes ago. So one practice you can do in the moment, and again, much easier if you're familiar with mindfulness overall, but you're certainly welcome to try it, is similar to how I laid it out. You can, we often come back to breathing practice again, just because we're breathing, it's something you can pay attention to that gets you out of your thoughts. So one practice you can do is in the middle of the moment, it's just for a few breaths, for the sense that I do when I'm practicing it is within each in-breath, there's that sense of just awareness, which is important because it's that ability to say like, I'm feeling really rattled now, or everybody around here seems really rattled, or, what you're just taking the whole thing in, like, this is a really difficult situation. And then on the out breath, again, it's grounding yourself or setting that intention of just what can I bring to this moment? May I stay, quiet and grounded? May I hold on to my sense of humor? May whatever intention you want to set for yourself can be, again, it's that reminder to come back to your intentions that you brought up at the beginning of our talk today. So, so that maybe just for 3 or 5 breaths, no one else even knows it's going on. You're just trying to come back to, like, you feel yourself going off into stress and crisis mode. And then you're coming back, to that ability to step out of flight for a moment and come back to your intention of, like, may I just stay calm in this moment? May I just stay strong? Calm is a loaded word, but may I just stay strong in this moment? Or may I just stay kind in this moment? Whatever feels appropriate to you right then. And that can have a powerful effect on some situations, even if you have no idea what to say or do. Just coming back to your own sense of strength and resilience, really does make a big difference all on its own.
And that you can set the intention, that's up to you.
Absolutely. Yeah.
What's a kind of a parting note you want to have for listeners about the whole practice of mindfulness and self-compassion? What would you like them to walk away from this with?
I guess the most important thing on some level is just recognizing that these are all practices that are really accessible to anybody if you want to. We're working on building traits, and that's something anybody can benefit from. And maybe, I guess I would just end by coming back to, I think I said somewhere towards the beginning, which is the single most important thing about working with mindfulness and self-compassion is that it's not like a prescription and it's not cookie cutter. It's really that if you listen, it's about finding the parts of it that seem accurate and valuable to you. And they're only going to be valuable in your life if you go out and try them. It doesn't matter what I said today. It doesn't have any impact on anything unless you go out and decide it's useful and make a practice of it. And I guess I would just end by saying there was a great quote I heard recently that I think is a really important one, which is, of course, all these things are impossible to do consistently 100% of the time. Of course, no one lives that way. But how many people are actually setting the intention to live that way? And that has a profound impact on how we're living. I mean, most, that's it. I mean, of course, we're all imperfect and we're only doing our best. But how many people are setting the intention to come back to living life in this way? And that's an important thing to consider.
Yes. And thank you so much for appearing on the podcast, Mark. I appreciate it.
Oh, I appreciate it. It's always great talking to you.
Thanks again to Dr. Mark Bertin for appearing on the podcast. Dr. Mark Bertin can be found at developmentaldoctor.com. And that concludes another episode of Talking Brains. And I'm your host, Dr. Stephanie Sarkis at stephaniesarkis.com. Please hit that subscribe button and give us a rating. It's much appreciated, and have a wonderful day.